So last week, if you were with us, you would have known we gone through a few mobility exercises that are useful for you to stay active and keep your body mobile at home. But today we are actually going through the second series, which is a bit more rehabilitative exercises. And specifically, I've chosen the shoulder because it's a common site of injury for those of you who play sports or do upper limb exercises. Yeah. So afterwards, you can just look forward to different topics. We have installed maybe strength training or sports massage. And as Alvin said, please tell us what you're interested in so that we can really input and make this content beneficial for you. That's good. Now a bit about myself. Well, some of you might have seen me around before. My name is Sheng Min. I'm a physiotherapist registered and I'm practicing in a hospital, public hospital now. Bit of my background, I graduated from a university in Australia and I'm here working with different populations. So some of the backgrounds of clients that I work with come with post-operative injuries, so they have like knee injuries or back surgeries and they really need to get back on their feet. I also work with people with chronic medical conditions, so people who are really struggling to get along day to day, just giving them the best way to function. More importantly, I'm actually really interested in sports. So obviously I'm quite a sporty person and I get injuries myself and I know people who get injuries, and I find it's so important to prevent the injuries before they start. And so I'm here today again to share with you about the shoulder and what kind of pains you can experience and how to prevent them. So hopefully you learned something from me today. I'll be in the clinic with Alvin, Sylvester, Diane and Priscilla. So if you come in and you see them, you might see me around also, then just say hi lah. If you have any questions about today's session or future questions about your own injuries and conditions, just book a session and I'll help you out. I'm more than happy to do that. Great. So just moving on also, we'll look at now the rough content of what we'll cover today. So firstly, I'll talk about some myths and injuries, myths about injury and recovery, specifically pain. I'm sure all of us have experienced pain at one point in time and how to deal with this pain. How should we think of the pain that we're experiencing? Then I'll also look at some of the anatomy and the causes of shoulder injuries, because often we're very blinded by what the internet says, so many things, what's best for your shoulder, what's not best for your shoulder. But really, I believe coming down to the core of it, looking at the anatomy and understanding how your body works is the best way to help yourself. So I hope to share this information with you. And then lastly, we'll go through some simple exercises that you can do at home. And these are all anatomically relevant. So they're all based on science, and it's really not to bluff you. And of course, at the end, we want to hear how you found the session, hear any future questions you have for us. So we have a Q&A, we will answer your questions on the spot. Otherwise, you can also just ask me any other non-relevant to the shoulder questions, also can. Great, so just moving on, just a quick disclaimer. Obviously, this is a remote setting. I can't go in and look at each of your injuries on the camera. So it's also not prescriptive, so these are just general information shared. If you're feeling unwell today or you had a recent injury and pain, any discomfort, you can't move your arm, please don't push yourself through this session. Just take a rest and just listen for now. This information will still be very relevant to you. Great. So maybe we'll jump right in. I'm going to cover 3 myths about pain. This is what we're supposed to be interactive. I want everyone, now that your screens are on, you can also raise a hand. I want to hear if you think the myths are true or false, and then we'll debunk them afterwards. Good. So the first myth, it is painful, so I should rest. I'm sure all of us have experienced some kind of pain and we tell ourselves, oh, today I just can't wake up. I need to lie in bed for another 1 hour. I need to stop all the exercises. I need to go take MC for 1 week. How many of you think this is true? Just because it's pain, I should rest. Lots and lots of rest. If you think this is true, please raise your hand now. So everyone thinks that if it's pain, you should just take MC, take lots of rest. Well, unfortunately, I'm going to debunk this myth now and say that is false. Just because you are in pain doesn't mean you should rest and just keep resting until the pain goes away. So this principle is actually based on the principle of active recovery. Sometimes when we get an injury and the tissue is damaged, we actually need blood flow to the area to supply nutrition, to remove the toxins. So instead, resting in bed, you think about it, your heart rate is low, your muscles are not pumping blood. So this may actually delay and prolong your injury recovery. So actually the principle of active recovery promotes some light intensity exercise, which can mean just going out for a short 10-15 minute walk, even if you're feeling unwell. try and continue with your work. Maybe not take MC, but cut down the workload that you do. Of course, I understand if you're really having a fever and you are really unwell, then the MC is relevant. You should rest for 1 or 2 days. But if you're resting for a week, 2 weeks, that will really delay your injury and recovery. So yeah, I hope you learned something new today about this first myth. Just because it's painful, you should not always rest, but rest in the adequate amounts. Good. Move on to the second myth now. Again, I want to hear from all of you. Pain is weakness leaving the body. The people going to the gym always say, no pain, no gain. How many of you think this is true? Move on to the last myth. Again, thank you so much for your participation. We'll go to the last myth. Now, if I keep getting a pain in the same area, it must be an injury, there must be something wrong, there must be a broken or ligament or something is torn. How many of you think this is true? No one responds, everyone's not sure. Okay, it's good that you think that way, because actually this is a trick question. It really depends. It depends on how you got the pain, mechanism of injury. Was it a trauma? Did you fall down? You hit someone in your sport? And also it depends on the site of your injury. If it's very serious, you can't walk, then it's like a big injury. So I guess many of the times when we have pain, right, we just go and Google shoulder pain, then we diagnose ourselves, we have cancer. So it's very extreme examples. But the fact is that a lot of musculoskeletal injuries cannot be pinpointed even on the X-rays and scans. Just because I have knee pain doesn't mean I have a back pain, or have a slip disc. Sometimes even the doctors are not 100% sure based on the screen, the findings. So please, if you are concerned, come into the clinic here. A lot of therapists are very equipped with understanding the human body, so we will give you tips. We won't be able to diagnose exactly, okay, so L1, L5, L6, but definitely we will understand the body and give you tips to move on from your injury. So that's just what I want to share with this last myth. So just to summarize a bit of content that we've covered, when do I come in and ask for help? When do I keep pushing on with my pain? So the ones that you see in red, specifically if you had a traumatic impact, if you experience night pains that keep you awake, if you have rapid swelling in an area, you can't move it, or you just feel unwell, you have fever, can't eat anything. All these things in red are signs that you should see a doctor, get it checked. But other than that, the things in purple. So if you have pain that has been going on for 1 week, a small ache or instability, you feel that it's always annoying you. These are things that we can help you here in the clinic as well. Just come in. We're more than happy to get it checked for you. But I believe it's so important to really prevent these things from getting worse. So come in and we'll check it for you, prevent your injuries from getting worse. Alright, so now that we have covered the 3 big myths and I shared with you a bit about pain and how to manage it, the next time I'm going to share with you some common shoulder injuries, and I hope to hear from the audience, anyone who has experienced this before yourself, or someone else who has experienced it. Please, I guess, mention it. Either unmute your mic and share with me like, oh, I've had a fracture before of my shoulder, or you can even type in the chat box. So anyone here has experienced any of these injuries before yourself? So I just talked through some of the most common ones that I see in my own clients. So firstly, we have shoulder dislocation or subluxation. So it's actually very common in people who are involved with overhead sports, or even active, let's say you're a rugby player and you have to make a lot of body contact, basketball player. So dislocation happens when the humerus moves anterior, so your shoulder moves anteriorly out of the socket, because that's the least stable spot. So a lot of people, you will find ligament strains in the front of the shoulder, some capsule strains, and often you really cannot lift your hand more than like 45 degrees for 3, 4, 5 weeks. It's really debilitating because you find your arms so weak and it's so hard to get back to your original activity. Yeah, the next most really common injury are, I think, rotator cuff and tendinopathy that go together. So what is the rotator cuff? Right, it's actually a deep muscle. In the next slide, you can see the anatomy of the shoulder. On the left side of the body, you see this piece of bone. That's your shoulder blade now. And right now the shoulder blade is bare and empty, it's nice and yellow. But actually in the shoulder there are deep muscles that sit on the back and the front of this little plate. They're called your rotator cuffs, and they help to hold the humerus or the other part of the shoulder intact. So people who have rotator cuff strains or tendinopathy means that these rotator cuffs are not working right, they're overused, they're very tired. So often you get this instability, even like a clicking or very like deep dull ache in all the movements, and sometimes it doesn't come with any, like I didn't fall down, I didn't play any sports, it's still there. But it's very common overuse injuries, which means you need to come in to see us. We can give you some treatments to relieve the pain and also teach you some exercises to move on from there. Yeah, and I think I just cover quickly the last most common injury that I see. I'm not sure if young men like you would have experienced it before, but it's actually frozen shoulder. So what is frozen shoulder, right? If you look back again at on the right shoulder, where the shoulder blade or the scapula meets the humerus, besides all your bones, your muscles and your tendons, actually at this articulation there's this structure called the capsule. So this capsule is just a soft, spongy structure that provides nutrition and fluid to the structures in the area. So this capsule can actually become inflamed, and that's what happens in frozen shoulder. It becomes very stiff, very tight, and it can last for very long, doesn't have any particular cause. Some people experience it for up to 2 years, and it just comes and goes by itself lah. Obviously with that it's very stressful, because you go to the hospital and they're just like, you just wait long, you come back in 2 years time, which is ridiculous lah. So you come to the clinic, once again we have treatments here that really help improve your range and get you back to your sports and your daily activity again, especially for frozen shoulder. That's great. Thanks everyone. Hope you learned something new today. Feel free to ask more questions at the end of the session also. Right, so now move on to the final part of our session. Actually, I'll talk through some exercises that we go through today specifically for the shoulder, especially with the structures that I just covered previously and some of the injuries. These are all very beneficial. Of course, these exercises won't work for everyone. Just because I have a frozen shoulder doesn't mean I must do this exercise, or this exercise is like the best exercise. In fact, if you come in, then you're able to recommend based on your symptoms, like which structure is tight and which structure needs to be strengthened. Then you will find the exercise a lot more worth it. But nonetheless, hope you can learn what exercises there are for the shoulder and how you can use it for yourself. Good, so the first exercise that we're doing is the rotator cuff strengthening exercise. Right, we just start with your arms about chest level together like this. So as I mentioned previously, the rotator cuff helps with your humerus rotation. So I'm going to lift my hand off the other hand up like this, 90 degrees and down. Yeah, very good. Make sure that you're not lifting your shoulders up, because that's a shoulder flexion exercise. We're doing a rotation exercise. So this will work all the deep muscles that help to rotate your humerus. Humerus is this upper arm right here. Very good everyone. We'll do it 5 more times. 1, 2, 3, 4, 5. Anyone having shoulder pain now? No, right? Because you're all fit and healthy people. So to make this harder for yourself, you can actually hold a weight or a 500 ml water bottle and hold it in your hand. Now we alternate to the other arm, the left arm. Same thing, it's a rotation exercise, not a flexion exercise. And here we have, in the clinic, we do have a 500 gram weight now. So just hold it in your arm like that and lift it off. 90 degrees and down again. Well done. So you can hit 90 degrees, it means that your rotator cuffs are strong, not too tight, you've got good range. But if you're having trouble really reaching the end range, it means something is tight and something is weak. So you need to come in and we will have it checked for you as well. Right, last few ones. 3, 2, 1, and done. If you feel a bit of soreness deep in your shoulder, then you work the right muscle, that's the rotator cuff. If anything else like front pain or back pain, then it's probably the wrong muscle. Okay, good job everyone. We move on to the second exercise now. This is for your serratus anterior. For those of you who are not familiar with it, this is the muscle that helps your shoulder blade to stick to your ribs. It is a very important stabilizer when you're reaching up or front, because the shoulder blade also moves forwards and backwards. So when does the serratus anterior work? Obviously, it's actually a pushing muscle. It helps to push your shoulder blades forwards and backwards. So please go to a table or a wall near you right now that you can find. get into like a wall push-up position. Very good, Damien, using the table, right? So when you're doing this scapular exercise, you're actually squeezing your shoulder blades together and then pushing them forwards. Make sure you don't move your elbows because it's not really an elbow exercise. You're pushing your shoulder blades together at the back and then pushing them forwards. We'll try 3 times. 1, 2, that's right Ethan, good posture. 3, 4, 5. Now Gary is doing a wall push-up with his elbows. That's like it's a full push-up. Actually, this is a scapular exercise, so you should really feel your shoulder blades squeezing together and moving out. You don't really need to bend your elbows. I think we all need a bit more practice, so we'll do it 5 more times. Yeah, 5, 4, 3, 2, 1. Okay, well done everyone. Thanks for jumping in. I think we all need a bit more practice because this exercise is quite hard to master. But if you can do a full push-up, the shredders and tears are probably quite strong lah. Yeah. Okay, move on to the last exercise now. It's something you probably never heard before. It's to work your lower traps, and it's called the Y wall push-up. So once again, if you don't have a wall, it's fine. Let's make sure that your elbows are in line with your body and you're as far back as you can. So this actually activates the rhomboids as well as the lower traps that are here in the middle of your body. So really open your chest out wide into a T position, like this. And then I'm going to slide my hands slowly up from a T into a Y and then back down. So you have to do this while really maintaining that line of your elbow and your body together. And that really activates your lower traps and give your shoulder blades that stability that it needs lah. So 1, up high to a Y, down. 2, up high to a Y, down. 3, well done everyone. Really squeeze your shoulder blades together. 4 and 5. Okay, take a rest. And with that, we've come to the end of our exercise session.